course, Ghana's Minister for Health, Kweku Agyeman-Manu, says diabetes is set to become one of the leading causes of death by 2030. And so Ghana and other lower middle income countries need to spend more to fight the disease. Speaking during the signing of a memorandum of understanding between the Health Ministry and a French multinational healthcare company, Kweku Agyeman-Manu said fighting and treating diabetes must be put on high on the national agenda.
There is a high financial burden on persons living with diabetes. The testing kits, the glucometers, the strips, and medication, just not affordable for a very huge proportion of our population. Although some part of the cost of care is covered by the health insurance authority that we have in our country, extra costs in terms of care, time, and nutritional support are borne by the patient, their families, and providers through out-of-pocket payments. Due to the chronic nature of the disease, the cost of care trends to be lifelong, further driving families and communities into poverty. And in some instances, we can even talk about catastrophic expenditures based on the poverty level of whoever is afflicted with the disease. Diabetes is a significant public health challenge that requires all to come on board. Indeed, the Sanofi and the Ministry of Health Affordable Access to Diabetes Care Program is a timely intervention necessary to enhance the management of diabetes in our country, as persons diagnosed with the disease have a greater chance of having access to equitable, comprehensive, affordable, and quality care for better outcomes. The stipulated objectives of the program seek to address some of these concerns, and the Ministry of Health is ready to render its full support towards its successful execution. The good news is that this partnership we are entering into with Sanofi is one of our planned activities as a way of implementing our NCD's policy and one of our strategies to try to make sure that Ghana attains universal health coverage by 2030. It is my hope that with such initiatives we will continue to strategically position Ghana as a global health leader through complementarity, cooperation, and effective partnerships.
Meanwhile, head of Ghana's National Diabetes Management and Research Center, Dr. Yakoba Tiasi, called on government to fund diabetes like it did when Ghana recorded cases of COVID-19.
Diabetes is said to become one of the leading causes of death in our country and elsewhere by 2030. We are proud as a ministry. We have developed and launched the National NCD policy and strategy.
So diabetes is behaving like an epidemic. It is looking like an epidemic. So why are we not treating it like an epidemic? There's evidence to show that in any epidemic, the less you invest in it, the higher the mortality. Thankfully, we have all lived through an epidemic. In 2020, we lived through a time many people will never live through, a disease covering the whole of the world. But before 2020, diabetes was already covering the whole of the world. So we were already living in an epidemic, although we chose not to see that epidemic. How do you handle an epidemic? An epidemic is handled very easily, and we did that very well in Ghana. And today, we are all sitting here without face masks. But a few things happened in 2020, which has brought us here without face masks sitting together. There was massive education. Everyone knew about COVID. And even my illiterate patients will call me and say, "Doc, I think I have COVID because I am coughing." On that note, Honorable Minister, I'd like to plead and implore that the Diabetes Center, which we started renovating a few years ago, will be complete for us so that we can offer the excellent care we are meant to. And I'll come and see you in your office after this meeting.